There we go. I got to turn this back on. So recap, don't hit the person is pregnant. Make sure I put this on the recording. Don't hit that the person is pregnant because that will just cause all kinds of trigger problems unless they want to go on Medicaid. Once the child is born, then they call you, they let you know. Now, if you're running a quote for somebody and they want to know, oh, what's it going to cost? And say, all right, when's the baby due? If it's not due till November, just run it as two people, run it is, and they'll get that last couple months different. But if it's early in the year, run a quote as if the baby is already here. The baby's going to be born in March. A third person on their family could be the difference between a good CSR and no CSR. Well, why make them be in a bad CSR for 2-3 months or a bad plan when adding the baby puts them in a good CSR? So run the quote for what it would be like when there's 3 of them on there, and then manually make the system keep them in that plan. So I'm going to show you really quick. I'm going to pull up my quoting tool, and we're going to look at that. So you can see what I'm talking about. All right, so you can see my Health Sherpa. So here's Health Sherpa. Person is 35. We're going to add the spouse. They're 32. Maybe they already have a kid who's 5, and they're about to have another one, and they make $45,000. This is how you quote it to keep the kids on the plan. You hit that little button. I'm really glad Sherpa added it. So if you want to know what it's going to cost for all of them, click that little button right here. So we come down here. I'm going to look at the silvers. This is the cheapest CSR. It's a $3,000 out of pocket. But if I add another kid, 1-year-old, and then I say they're not eligible for Medicaid, are they still at 3,000? What if they were right on the edge? What if they were at 40? I don't have my chart up here, otherwise I'd know the numbers right away. And the deductible would be lower because they've got 4 kids, right? They're right on that edge. Versus if they didn't, it's 3,000. Well, why not just keep them? And look at how much the premium is, $7.31. I add this kid, they can afford it, I'm sure. Now the premium's nothing and their max out of pocket's even less. Or my area, I would come down here and I would enroll them in this plan. It's free. Their max out of pocket's $1,700. So now instead of having them pay $3,000 out of pocket, this is what it's going to be in March when they finally tell you that a baby's happening. But the insurance companies are not going to backdate the max out of pocket. Let's say she reaches, you don't do this. You put them in the plan without that 4th person in there. Now see this plan. I'm going to go take this 4th person off. And the mom has, this is the plan I'm going to enroll them in. I'm not so much worried about the premium, right? They can afford $16. But this mom reaches the $3,000 max out of pocket for other reasons. Then you add that child, and they could have only paid 15. The insurance company is not going to go, hey, you should have only paid 15. Here's your $1,500 back. They're going to say, nope, you've reached your max out of pocket for the rest of the year. You could be saving that family $1,500 instead of 3,000. What if 2 of them reach the 3,000, right? The max out of pocket times 2. If they're low income and they're in that CSR, 3,000 is a lot of money. But it's going to be 1,500. So you can manually do it ahead of time. It's like, all right, this is the one I want to put you in. I want you to have 1,700 max out of pocket. It's not going to cost you anything because they're going to be a family of 4. Figure out what it will take for a family of 3 to get that same low dollar amount. That same low max out of pocket. There we go. So a family of 3 people to get this really good 1,700 needs to have income of 30,000, not 40. So I would put them in at 30,000. Have them be in that, and then say, as soon as the baby's born, you have about 2 weeks or so to give me a call. You don't need it right away, just give me a call. I have had people literally text me from their hospital bed after they gave birth. I have the baby. And I'm like, okay. Well, that was a record time. I think that baby was born 30 minutes earlier. They don't have to, it's not quite that rush. The baby will be covered. They do have time, right? They have time. But I just tell them, as soon as they bring the baby home, you got a month, give me a call. Then I go in, I update the application. I add the fourth child who's now there. And I change their income to what it should be, 40,000. I go to 40,000, and then they're back in that plan for nothing at 1,700. I'm manually doing it ahead of time, knowing that that's going to happen. Worst case scenario, the baby dies. Well, I still have them in a better out of pocket. And all they have to pay back, and they don't tell me that, right? They don't tell me because I have so many clients, I don't keep track of everybody who says they're going to have a baby. And they do their taxes at tax time, and they really only had a family of 3. Well, this is costing them nothing. It turns out this baby didn't make it, which is pretty tragic. But they only owe $18 a month. But I saved them $1,500 per person. And they don't have to pay that back. So remember, they never have to pay back that deductible, that max out of pocket of a different CSR if they end up making more money. They just have to pay back the IRS. That's who needs to know. Does that kind of make sense? All right, I know there was some chat questions going on, so I'm going to look really quick what that is. If I can get this system. There we go. All right. And Nancy, I will email you directly. I don't list the unborn kid's birthday on the app. You can't do it ahead of time. I'm just saying for the quote. So you quote the baby as if the baby's born, so when they're going to have a family of 4. And then I adjust the income of the family of 3 to match what it would need to be when it's the family of 4. So you don't put the new baby on that plan. You don't actually put the baby on the application until the baby's born. This is just for quoting. So this is just so you can know what it will look like when there's 4 people or 5 or 2, whatever, what the family is going to look like when the baby is born. When you put that, Melissa, you said, do you have a social security number? So when the baby is born and they call you, right? They call you within that first month. Hopefully some of them have taken 2 months. You say, all right, as soon as you have the social security number, you call me. So you do the application. The baby doesn't have a social security number. You say that, and you get that message, right? That says, hey, you need to give us proof of citizenship. And you have like 60 days. So it's okay. Actually, you have 3 months. You just tell that parent, all right, as soon as you get that social security number, just call me. Then I'm going to go in the system. I'm going to update it. I'm going to add the social security number, and that request of citizenship just goes away. I know a lot of you spun your wheels trying to figure out how you prove citizenship. You don't until they give you the social security number. That's what they need. Don't worry about getting birth certificates and all that kind of stuff. No, just don't waste your time. Just tell them you have to give me your social security number of the baby as soon as you get it. If you don't, you're going to have to pay $400 a month for it. Whatever, throw that number out there. Parents are pretty good. And then we put in our system a reminder to call them, email them, text them 2 months to say, hey, where's that social security number? Remember, they're going to take the tax credit away. Then you just update the application, add that social security number, and that request goes away. Jill, so the IRS won't care because the new child will be applied to the tax year. Therefore, it doesn't affect them in any way. Correct. Nobody would ever delay. Because remember, the IRS doesn't care when a baby's born. You are a family of 4, even if that baby was born December 31st. So, I remember when I was pregnant, my child was due on 1/1, and somebody was saying, well, you want your baby born on the 31st so you can get the tax credit for the year. I said, well, actually, 1/1's better because there's lots of awards, and I guess the first baby in America born on January 1st gets lots of crap. But, correct. The IRS is a whole tax year, not prorated. So, Jill, you're absolutely correct. And I know Kentucky, I know those state exchanges, whole different thing. In some ways, they're too smart for their own good, or at least they're too smart for our clients. The federal marketplace is eventually going to catch up. It's going to happen, but right now, this is the way you can do it. Boris, you can actually send me a message and we can talk for like 15 minutes. So Charlotte, the best quoting platform you're new to ACA, welcome. You're welcome in your good group. I love ACA, it's my passion. The best quoting platform for Florida is the same as anybody who's using the federal marketplace. So we like Health Sherpa and Insura. And if you would like a link to those, I can send them to you. They are great. I love having them. Gail, would I have issues with income match? You might. They might say, that income seems lower than the last time you filed. Or it might say, this seems higher than the last time. Ever seen that? Usually, not always, but usually you get the magic question. It says, is it changed because of 1, 2, 3, or 4? It adds 1 or 4 options. You will say it's changed because of a change in job, retirement, or whatever. If you answer that, it doesn't ask for proof of income. But let's say it does. Let's say it asks for proof of income. You have 3 months to send proof of income, right? You can write a letter of explanation, or you can wait till the baby's born and then you're updating it. The letter of explanation, which I have sent out before, we've talked about that's my favorite thing. And CMS just came out with one. And unfortunately, it's at my other computer. So I am going to share it next week just because CMS shared it. They have a very easy letter of explanation that's almost identical to the one I have been submitting for years and years and years. Basically says, to whom it may concern, for application number, boom, you put the application number. In regards to request for income, the Smith family estimates their income to be $35,000. And you just match 100% whatever you put on the application. I've literally copied and pasted. Just cut, pasted exactly what I put in the application. Bob's going to make this, Susie's going to make this, and their 6-year-old isn't going to make anything, because I've actually had that happen before, which is really strange. They wanted to know what the 12-year-old was making. My system. There we go. It was trying to send it to people that were waiting to get in the waiting room. So there's my list of what's coming up. It's not a smart system. So you can just do a letter of explanation. If the baby's going to be born sooner than that, hey, don't worry about it. Just when you go in and you update the baby, you're going to update their income. So there's lots of ways around. Remember, it's not a smart system. I think we always expect it to be, right? We have the smartest computers in the known world sitting in our hand. I mean, do you realize the person who went on the moon with like the 17th% of what's on this computer? We're so used to fast things, smart things that are intuitive. The state exchanges, they do tend to be a little bit smarter because they can have more control. And remember, the state exchanges, I was talking to somebody about this, the Medicaid and the state exchanges are like this. It's the same system. So yeah, you're not going to be able to get out of the state Medicaid system, but why would you? It's all the same. I think people that are trying to get out of a state exchanges Medicaid system still has in their mind that means I'm poor. That means I'm going to show up with green, food stamps and food share. That's not what that means. It means you have a state who says you're important. And we want to make sure that while you're pregnant, while your income's at the certain level, we would like to take care of you. There's a reason you pay taxes in those states. I mean, you pay some taxes. Wisconsin doesn't have a Medicaid exchange or we haven't expanded our Medicaid, but we have been covering everybody, male, female, babies, child, adult, males, whatever, if they're under 100% of federal poverty level for years and years and years. And we pay high taxes. But that way, when you lose your job and you need it, it's there. And when you don't need it, that's great. So kind of tell your clients that are worried about, especially in the state exchanges, there's no shame in this. There's nothing wrong with this. This is proof that your state cares about you. So, now Texas has a very, very low Medicaid system. They don't. South Dakota is kind of changing some things. But if you don't have a really high state tax, you're not going to have a great Medicaid system because that's where it's coming from. And Texas is spending most of their Medicaid system on nursing homes. I don't know if anybody knows this, 90% or something like 75% of Medicaid money goes out to nursing homes because most people cannot afford nursing homes. So don't think it's them, right? Oh, those poor people. It's not. It's actually our elderly in nursing homes. But if you're in the state of Wisconsin or in the state of Texas, unless you're like 2 days old, they're not covering you, right? The system's not smart enough yet to figure that out. So you'll have to make it figure that out. So Judy, if a client has high income and doesn't qualify for tax credits, do we still enroll them through Health Sherpa? Personally, I like to, because then all my clients are in one spot. But there's a button that says, would you like to apply for financial assistance? The answer is no. I don't want to apply. Well, then it's just their name, who they are, their date of birth, social security number. That's it. It's the fastest, easiest application. I do know that some of the same carriers that are on the exchange will have off exchange plans, and it does kind of make things a little easier sometimes, but the rates and stuff are usually pretty similar. So personally, that's me, but you do have to know your state. You do have to know your carriers. If you have a carrier that's like, well, off exchange, I have this one really amazing plan that's better. Okay, well then go directly with them. You know, if Better has this off exchange that's different and is a lot better, maybe it's worth it. But I like using Health Sherpa for like 99% of my clients. Partly the reason I like to do that, just again, having done this for so long, was there was a lot of clients who did not qualify for tax credit. And then Biden got rid of that cliff, that income cliff. If you made more than 400%, you used to not get 400% above the federal poverty level, you used to get no tax credit. And then in the middle of the year, suddenly they did. And I had always put most of my clients on the exchange. So that was awesome, man. I just called all those people. I'm like, guess what? You're going to qualify. You made 500% above the federal poverty level. Now you're going to get a tax credit. So it was really easy for me to go in there, update it, and then they got tax credit for the whole year. The people who were direct, we had to call them and say, you need to come on the exchange. And we had to start them over, and they did not get tax credit for the full year. They only got tax credit from when we put them on the marketplace and enrolled them. So what if things change, right? What if everybody's talking about rates going up? Well, guess what that means? More people are going to qualify for tax credit. So if they're already in the Health Sherpa, if they're already on Health Sherpa or through the exchange, then I don't have to worry about trying to move them around. So I personally like to use Health Sherpa. Sharon, some state exchange systems are not so smart either, and those glitches haven't been fixed. Figure them out, man. Use those glitches for your client. That's how I learn. I push so many buttons, it's not even funny. And Kevin, I will send you some stuff. If you're asking for the exchange, I will send that over. Any other questions on that? It's really easy. I know a lot of people spin their wheels trying to find baby certificates and stuff, but as soon as you add the baby's date of birth, it backdates. Now, here's my cautionary tale. If somebody tells you they're having a baby in November, December, they have to call you as soon as the baby's born. Because if they call you in January for their baby that was born December 15th, now you have to call the marketplace. Now you have to deal with all of that because the system, as of December 31st, the marketplace starts over January. You cannot backdate anything. So it's a whole big hassle. Now you're going to have to call the marketplace. They're going to have to do this backdate to get December 15th, even though it's now January 15th. So the rule of thumb is you can fix anything in the future and babies in the immediate past, but once you go to the next year, you can't. Now it's a lot. It's not that the baby won't be covered, because the baby will be covered, but it's a whole lot bigger of an issue. So make sure if you have somebody who's gonna have a child born November, December, you really emphasize to them they have to call you right away, so that application can get backdated, the tax credit for the whole year can be done correctly. That was one of the things somebody stumped me. What happens? Well, what happens is you have to have the whole thing. You have to go through the exchange. Let's see. What do you use for an agency management system? So currently I personally have Agency Block. The reason we took it was because it had commissions. I recently learned of a new one called Agent CRM that, oh my goodness, I'm going to tell you right now, I was really excited. Like, I'm actually going to talk to that guy about some of his AI that can be integrated into Agency Block. If you were just starting out, certainly look at Agent CRM. A really very, very, very inexpensive one is called Redtail. It's $100 a month and you can put up to 100 people on it. It's pretty simplistic. It's really easy. There's also, I've heard of less annoying CRM, but I've heard people outgrow that one. So if you already have a decent size or you're planning on it, maybe just jump up to Agency Block or Agent CRM. Could you ask a question? In Texas, no Medicaid for most adults. How do we handle low income? So yes, you click on the button that says you say not eligible for Medicaid. I don't estimate a higher income. Now you have to have at least 100% of the federal poverty level. If you say that they make $99,000, it's going to, and that they were denied Medicaid, the system will say, oh, well, you don't get a tax credit and it's really strange. I always put at least the minimum amount. Now I tend to like this year it's 13,000 and something. I'm probably going to put in 14. So in case they get auto renewed next year, I don't have to worry about it going lower. There is never a penalty for making too little. Okay, I have a guy who has not qualified for a tax credit since I think the start of it. He has never paid back tax credit. The IRS is not going after poor people. If you say I make 15,000 and you made 14,000, do they ask for the tax credit back? No. If you made 20,000, you said you're going to make 25,000, but you actually only make 14,000. Do they ask for it back? No, they actually give it to you. The same as if you say they're going to make 15 and they make 8 or 12. They never have to pay tax credit back. Now, you do have to put Social Security income on there. And I see you're asking, so Marilyn, you're saying, if the spouse is on Social Security disability, will that higher estimate affect their disability income? Nope, doesn't affect it. Because remember, disability income is based on a person's disabled status and on that person's personal income difference. And again, system isn't smart. It doesn't talk. And I'm going to tell you something that is, again, how smart or not smart the system is. So you know that giant list that it gives you, and it says list everything that they make. Social Security, income, gambling. The truth is it doesn't matter. If I know the family makes 30,000 and I want to say they make 30,000 in investment, and that's just what I put on the application. The IRS does not look at the application to see how you line itemized it. They just want to know that it's 30,000. They don't care that I said it was investment or gambling or whatever it is. The IRS just wants to know the bottom line. So I use investment as my catch-all. Let's say somebody's collecting Social Security. They're really honest with their income, but they're not going to collect it until August. Well, if you go in the system and say they're going to collect Social Security and you even do the math calculations, they're going to get $1,000 a month in Social Security starting in August. So you go, okay, August, September, October, November, December. All right, 5 months. So I'm going to say 5,000 of Social Security. Do you know the system's going to ask you for proof of their Social Security? Because it's going to go, well, we don't see that they're collecting Social Security. So then I just say 5,000 of investment. And the system goes, okay. That makes sense. It's not a smart system. They just want to know what that dollar amount is. I think the reason they have that itemized is to help the individual person who's going in there figure out what their income is. Okay, so how much do you make by this? How much do you make by this? So they're trying to be helpful, but the IRS is not comparing the line items that you put in that application to what is brought in as income. They just want to know what the dollar amount is. So Jessica, what reason did you give to allow you to enroll the private plans on the marketplace? Always. They're all private. So remember, the marketplace is still private plans. They just don't click that they're requesting income documents or they're requesting tax credits. So marketplace insurance is still private insurance. It's just whether a tax credit is being applied. So the plans are identical. The carriers are only allowed to adjust the off exchange plans slightly. They're not allowed to say, well, on the marketplace, the gold plan's $1,200, but off the marketplace, it's $800. They're not allowed to do that. Now, they may say it's not $1,200, it's 11,050 and we added dental. They can do a little bit of tweaking for their off exchange plans, but if it's an insurance company that has on exchange plans and off, it's only a little bit of tweaking. It's only a tiny amount. But if I have them off exchange direct with Anthem, United Healthcare, or Common Ground in my area, and then they do qualify for tax credit, now I have to put them on the marketplace, and they will not get tax credit for the whole year. They're only going to get tax credit for when I put them on the marketplace. So I personally just enroll them through Health Sherpa, and I just don't apply for tax credits. Yep, John, can't use Health Sherpa on the state exchange. I think there's 2 states that have them, but yep, you have to use the state exchange. Yeah, Jessica, you were told about a baby in June who was born the year before. Well, my guess is it must have been on the Medicaid system and the baby was born. And if not, well, then, there's not really anything we can do. They are not going to backdate a year. They're not going to go back that far. Maureen, how is it you keep them off the Medicaid? I just say they were denied Medicaid. Click that button. Sometimes I'm going to tell you why I ever did that. The first time I ever did, personal story. So I'm a family of 3. I had moved to Wisconsin. I had just started doing this job. I wasn't even an agent. I was running the office of these 2 agents, and I needed insurance, and I wasn't making anything. I mean, I was working like 2 days a week for $12 an hour. So I wasn't making anything. I went into the system and I entered my husband, and my daughter, and it said, your child may be eligible for Medicaid. So it sent my daughter's information to the state. And I was like, okay, and I sat there and I waited. Now, in the meantime, my husband and I are covered. My daughter is not. And then I got the letter that said she doesn't qualify. Oh, okay. So then I went back into the marketplace and added her. In the meantime, she had had no insurance, and it didn't backdate it. It only goes forward. So my daughter had no insurance for January and February because I didn't get the notice until February, and I put her on the marketplace for March 1st. Now, I was fortunate. I had a healthy kid. Nothing happened. I didn't need her. She was like 2 years old, but I didn't need to take her in. But what if I had? So I learned my system and went, okay, there is an income level that I know my state isn't even going to let her, isn't going to let anybody with children at that particular level. So I clicked the next year, denied Medicaid, even though I wasn't yet, but I knew I wasn't going to get it. The system went, okay. The system does not ask you to send proof of a Medicaid denial. Now, that being said, you do that. You say denied Medicaid, you go through the whole system and you get to the end of the year, end of the application, and it says send proof that they're not on the Medicaid system. That means they already are. So that means somebody is in the Medicaid system. I've had people who didn't even know, like, adults. These aren't even kids, adults who I punched them through and I'm like, oh, looks like you have Badger Care, because that's what the Medicaid in Wisconsin's called. It's called Badger Care. And she went, what? I've never applied for Badger Care. And I said, well, you do, sure enough. And she to this day, she's still not sure how it happened. I think she went into the doctor's office and the hospital might have done it for her or something. So if you get to the end of the application and it says, send us proof that somebody is no longer on Medicaid, they do have it. So then they have to either call the Medicaid system and say, take my child off, take me off, or they tell you, nope, oh, okay, yeah. And then you take the child off, or the person, whoever. What happens if you make 14,000, if you think you're going to make 14 and you make nothing? Absolutely nothing happens. You had insurance. So maybe you should have been on Badger Care or Medicaid or whatever it's called. Nothing. The IRS is not going to ask for money back from somebody who makes less money than is reported. Ever. Not saying that'll never change. The system's going to get smarter eventually. Every year, this guy, he's never qualified. But he insists that Badger Care won't take him. My state's exchange system is not going to take him. So then I remember, what was the reason of the Affordable Care Act? To cover people. And I've heard people, and there's some people in other groups that are curmudgeon-y, at least that's my word for them, and they're like, rah, this is, you're beating the system and you're trying to help. It has been proven over and over and over again, people with insurance that they can afford will use it before something bad happens. If you say, I'm sorry, I'm not going to get you this insurance, guess what? They're not going to use it until they really need it, until they're in the hospital, they emergency, they have cancer, they have heart attack, they have stroke, and now their bill is significantly higher. And do you think they're going to pay it if they make 13,000? If they make 12, of course not. Who's going to pay it? The state's going to pay it. The taxpayers are going to pay it. I would rather they get on the marketplace and they go, I'm not feeling so good, but I have insurance. It's going to cost me $10 to go to this doctor instead of waiting until they have a massive heart attack. So, why was the Affordable Care Act created? To give people affordable insurance if they can't get it themselves. So until they fix that system, I'm going to keep doing what it was intended for. There is legislation trying to get it changed. So I'm kind of manually doing now what they want it to do in the future for states like Texas, for states like Florida, states that don't have a big Medicaid system. But the system's not smart, especially the federal system. The system treats every state exactly the same. So in your state what is and isn't. Go ahead and manually make it do what it's supposed to do for your state. They had added Social Security, even if it's not taxed. Yes, Sharon, it is 100%. That's the adjusted gross income. That's the modified adjusted gross. So remember, it's not the adjusted gross income they want modified. So even if they have zero taxation on their Social Security, you add that. Melissa, I have a couple 75 and 77 with 55 retirement pension from the Dominican Republic. And I hope that will be counted so they do not have to pay full price. Yeah, that's the pension. I would go in there and say they get 55,000 for retirement pension. They live here in the States, they are, as long as they don't qualify for free Part A, they can go on the marketplace. Jessica, don't you need a reason to allow you to suddenly enroll in the marketplace? Yes, that's called a special enrollment period. On a typical normal year, which has not happened for about 3 years now, you would say, I've lost coverage, and the system would say, send us proof of that. They have not asked for that in 3 years. We have people bring their documents in because we're like, someday it's going to happen, but it's not going to happen. I can tell you right now, it will not happen till at minimum May of 2024 because hundreds of millions of people are getting kicked off Medicaid. They do not have the bandwidth capacity to have people submit all of those documents. So they're not asking for any documents. So I have told people, you know what? I know you're sick, you need insurance, and you haven't, but let's see if the system will let you. Oh, you're lucky, you got the system. The system's letting you in. Or you know what? We need proof of income. Now, that being said, if somebody's young, healthy, or older and healthy, I probably would put them in a short-term plan. They can pass it. I'm going to say, all right, you missed the open enrollment. Let's put you in short term till the end of this year, and then I'm going to get you in for next year. We'll figure out what's happening. I do not want to screw the system, but I also am not screwing clients. The system is made to protect people. So if people need coverage, they make 25,000. They're just over that thing. I'm going to do what they need to get done. The system isn't asking for any documentation or proof of the special enrollment. It just isn't. And I think it's because of the Medicaid rollback. I mean, having done this for years and having to deal with those documentation, I can't imagine them having any bandwidth at all ability to handle 1 million documents showing that the coverage is ending. So they're just not asking. If they turn it on, it won't happen until after the Medicaid rollback, which is May of next year. Though I will be shocked if it turns on till maybe July. We'll see. It'll happen. You'll say somebody loses their coverage, and for the first time, some of you new people will go, oh, it's asking for proof of documentation. My brother, Josh George, we talked about that. He's never had to submit it since he worked for me because it's not asking, but it's going to come back. It will come back. Be prepared. There's Josh. Yep. So Brian, sorry you're late. That's fine. As always, this will be recorded and it'll be on YouTube. The woman will think. So Marilyn, yeah, her husband, as long as her husband doesn't go out and get a job, it's not about household income. Social Security disability is based on your personal income. As long as he doesn't go out and make more than whatever it is, I'll just say 13,000, that's fine. The tax credit isn't got anything to do with her husband's Social Security. Oh, Judy, you found him. All right, excellent. Marilyn, you live in Wisconsin, Waukesha. Oh yeah, you live there in Waukesha and Madison. It's a beautiful state. Georgia will be integrating Health Sherpa and another web broker. Virginia's considering it. Yep. if you are in Georgia, if you have that license, a few people that have already done the exchange, their certification, it was fairly easy. So I would go do it. If you can, if you are already licensed in a state, a new state that's going to be bringing on a state exchange, just be there at the beginning. Just go ahead and jump in. If you've never been in Colorado's exchange or Minnesota exchange, that's on you if you want to learn how to do that. In New Jersey, state exchange, I don't know. Remember, all I know is the federal exchange. Pretty sure the state exchanges are actually asking for proof, but you'd have to find an expert in that state. That is one of my future things I'm trying to find an expert in each state exchange, and I'm just going to interview them and then just put them all on the market on the YouTube so that you can go, oh, New Jersey, New York, whatever it is. But that's a future project. I am still working on that. John, so if you report an income that qualifies for tax credit, but at the end of the year, they're below, they don't have to pay anything back. That is correct. Any more than if somebody says they make 100,000 and gets tax credit and they make 20, they don't owe any money back. The IRS actually pays them back. They're going, hey, you had too much. You paid too much. I live and work in a rural Apache area. When it comes to getting financial details needed for the open enrollment, my clients tend to feel it's an invasion of their privacy. Yep. Proof of income can be really harsh. I tell them one of two things. One, if you give me proof of your income, then I am correct. You are correct with what's in the system, and you're not going to have to pay anything back. And you are telling system, and you have to tell the IRS, right? It's the same thing. It's like the person's like, I don't want to give them my social security. The government already has your social security number. Now, if they don't want to tell it because of me, I say, are you okay with me writing a letter of explanation? And they will always say yes. And I type up the letter of explanation to whom it may concern. Here's the income I expect to make. Any questions, give me a call. And I type the person's name. They get a copy of that. I'm not doing this without them knowing. I send that to the marketplace. It's always accepted. So, yep, I totally understand. And say, but I remember, I just tell them, remember this is the government. They already kind of know. And when you file your IRS taxes, they're going to know too. What if someone made 200,000 so far, but is now unemployed? Unfortunately, it's the whole year. The government's going to say, yeah, you've got money, you know, you have to pay the full amount or whatever where your tax credit. Now, I have told people if you go 3 months, at least in my state, if you go 3 months without income, you could apply for Badger Care. You could apply for the state system, but probably not. In that case, again, short term, is that more affordable? Are they healthy? And I just need to get you through until you get a job. Okay, maybe short-term, just a short-term plan is better. 2-3 months of coverage at $200 versus 800 on the marketplace or whatever it is. Correct. I don't think it's going to make it more difficult, Brian. You said now this is entrenched entitlement. I do not foresee the current administration attempting to make it more difficult. You're correct. I do think that what's going to happen, remember, in theory, the 400 percentile is tomorrow's next year is supposed to be the last year. And then in 2025, it's supposed to go back to only getting a tax credit between 100 and 400% above the federal poverty level. I can't imagine that going back. It could happen. We might have a new administration, but whoever the new administration is going to have millions of people going, what the heck? Don't screw me because I make slight bit more than 400. So we will keep an eye on that. We will see that. So we are way over. I think this is the most we've done for a while. So yes, thank you all. The recording will be sent out and will be on YouTube as usual. You saw the list that I had. My email, I will put it right in the chat again if anybody wants to get something specific from me. Insurance.com right there. That's my email. Send me an email. Tell me what documents you might need. Tell me to give you anything that I can help you with. I'm happy to share. Thank you very much, everyone. I'm going to stop recording.